Hello again. I'm Bill Russell, President of Lake Norman Chamber of Commerce, and we have another issue of the Focus Friday. And as we start off, our presenting sponsor is Novant Health, Huntersville Medical Center, and we have Luke McDonald. Luke, would you share a little bit about what's going on maybe on the healthcare front with Novant?
Sure. Thanks, Bill and Senators. Good to be with you all. Thanks for joining us today. Novant's always happy to sponsor this event and look forward to it every month. A couple things, I'll be quick. The Leap for All group just recently released its hospital safety grades, and we're proud to say that among several of our facilities, Huntersville specifically was a grade A, the highest grade you can receive. So very good news there. Continuing just to reassure that the best care is provided in the Lake Norman area. Second thing I will share with y'all today is the Ray Evernham Foundation recently committed $500,000 to Novant Health for the development of behavioral pediatrics program. The Ray Evernham Foundation also has been supportive of the Martin Truex Jr. Emergency services at Huntersville that were recently expanded. So proud partnership there, and just exciting to have that continued support. And the final thing I'll say, I know it's all the way on the opposite end of town in Charlotte, but the Ballantyne Medical Center is still scheduled to open in June, shortly here in just a couple weeks. So really excited about that, to have that 48-bed hospital opening up soon. With that, really excited to hear this conversation. I know it's a busy time in Raleigh. We're all paying attention closely, so look forward to it. And thank you again.
And Luke, we appreciate the support of Novant Health. We're going to turn it over now to Jeff Tarte. He is our Public Policy Chair and the incoming 2024 Chair of the Chamber of Commerce. Jeff, please introduce our speaker.
Thanks, Bill. Thanks, Luke, for all you guys do in supporting us and being active members in the chamber up here. Well, today we have the pleasure of having Senator Jim Burgin with us. And what I didn't do last time, I'm going to do a little bit of this time, is talk a little bit about his background. And I will preface that by saying is Jim is a person who and I'm going to embarrass him here, absolutely we need to get behind him statewide to run for governor. This is the absolute perfect background. It's balanced, pragmatic, thoughtful, and respectful. And it's hard to find elected officials that fit that bill. But he's a business person. So he's somebody who is responsible for signing the front of the checks, not just the back of the checks. He's run, I believe, your own insurance agency for decades. You, I think, also do some commercial development, real estate development. I believe you own maybe part of an auto dealership. So he's got many businesses he's been in the middle of. He's someone who's akin to us because he's a active chamber member and has been a past president of his Chamber of Commerce in his hometown. So, and then two things. One, we won't hold against him. He's a University of Tennessee alum. We'll kind of look past that. Everybody has a flaw. But here's the one that most people won't recognize, and it's in the sense of know about Jim, but he also has an Order of the Longleaf Pine, which is the highest civilian award to a person in the state of North Carolina. And I'm even impressed that, and it wasn't yesterday, it was like in 2016. You serve on, I know, boards of banks and businesses and the community college. I mean, you are everywhere involved as a good citizen, active in your church, I know. So, I mean, literally, you have the bio to be the governor of this state, and it would be an honor to have someone like you serving that role. So that's who we have today. He also, and the reason for having Senator Burgin on with us today is that he chairs the Senate Healthcare Committee, and there's a lot of issues with that. And now we're closing in on getting the state budget approved, which he is actively engaged in. And so with that, I'm going to turn the floor over to the senator for a little bit, let him give us an update on what's going on, things he's cooking, and then we'll turn this into a little bit of a conversation on some of the healthcare related issues and maybe a little bit of the budget and things going on in Raleigh. So with that, Senator, the floor is yours, and we really appreciate you being here on Friday.
Well, first, I'm not soliciting another job, so that was a little bit shocking what you just said. But I appreciate the accolades, and yes, I'm a business person, and And I tell folks all the time, I think we need to be investing in things, not spending money on things. And so I'll take a few minutes and just talk about, I think, what's important in the budget. And there's a lot of great things in the budget. And I just finished spending the last 2 days with Secretary Kinsley. We flew out to Asheville yesterday and had meetings, had a town hall, a mental health town hall. It was the 10th mental health town hall that we've had. And then today we spent the day looking at some facilities and with the folks at Mission Hospital, and looked at a PACE program and looked at a nursing program and heard about all the things that we know are going on in healthcare: lack of nursing, lack of CNAs, lack of doctors. We've got a problem all the way across the state in every facility, including the state facilities, with people not filling those positions. And we have to do something about our employment situation in the state. If we don't, people are going to start looking and saying, why would I go to North Carolina if I can't hire anybody to work there? And I'm actually getting folks calling me that have been looking at North Carolina, and especially in my district, that are asking the question. I hear all these situations of help wanted signs at all the businesses. Why should I relocate, or why should I expand my business there if you can't provide me employees? So we've got to deal with that. And on top of that, as we do Medicaid expansion, which we will do when we pass the budget, hopefully about the middle of June, we're going to have a third of the total population of North Carolina on Medicaid. And friends, there is no way that's sustainable for the long run. We do not need a third of our population on a government program. So we're working on ways to try to make sure that doesn't happen, and that we quickly get people off of that. Some of the things that I'm real excited about being in the budget is a big commitment to pay for education for people in the healthcare business, and they're technically grants, but if they don't fulfill the requirement in service, they will become loans. There's $1 billion commitment to mental health over the next number of years, both in adding beds, increasing rates, looking at additional innovation waivers. There are so many areas that we need to be looking at healthcare and mental health care that there's plenty to do. I met a doctor last night, told him he was retired, he had 7 kids, and he was talking about some of the things he saw, and I tried to recruit him to come back to work last night. I told him that the word retire is not in the Bible, and he looked like he was young enough and healthy enough, and if he had 7 kids, I think he needed to be working a little bit more. So anybody that has retired, that has any, if you're a nurse, if you're a doctor, if you're anybody in healthcare, I'm going to ask you to come back to work. I know a lot of people got burnt out during COVID, but we need you, and we need to try to get ahead of this healthcare situation. And Senator Tarte, I'll be happy to I just want to talk to you. I just want you to ask me questions, and let's just visit.
Sounds good. Senator, I appreciate the update. Why don't we jump in? Because I want to get back into the healthcare stuff where we're finished to take most of the conversation. But what are the issues that you see, the differences that will be discussed that we're going to need to balance between what the Senate has passed and what the House will look for to concur?
I think there's a number of now I'm just going to talk about the healthcare part of it, because even though I've submitted a lot of things for other other areas of the budget, the healthcare is what I've really been focusing on. And we're going to get all the folks together starting next week. The House and the Senate chairs will meet next week and start the process. And we're just going to go line and line through some of the things. There's things that the House had in that we took out. There's things that are important that we put back in. But the process works really well. This will be the 3rd time that I've got to work on the budget. I was fortunate enough to get to work on it the first year as a freshman, and so this is the 3rd time I've been through it. And what I found with the chairs that we've all developed real close personal relationships is that all of us want the same thing. It's just how we get there. And so I think I don't want to talk too much about the individual things, because there's some that a particular person might have a real importance on that somebody else might not think is as important to them. But we try to make sure that everybody gets listened to, has input, and that we try to strike a fair balance between the House and the Senate. But I will say this, between both Donnie Lamberth and Larry, Representative Potts, and all the other folks involved, all of us are looking at this, the money that we're going to be spending on mental health. We think that is one of the biggest areas that will affect healthcare across the spectrum. One of the numbers that just amazes me is that 75% of the people that are using illegal drugs have an underlying mental health issue, and they're using the illegal drugs as a form of self-medication. So if we could deal with their underlying problem, we could maybe get them off of those drugs and get them out of that illegal activity that leads to so many other things. The sheriffs and folks in our prison system tell me that the estimate is 50 or 55% of everyone incarcerated has an underlying mental health issue. The statistics now is, 1 in 5 of people is having some mental health issue. The 150 or so people that were at the event last night, person after person got up and talked about either their own personal journey or one of their children. And a 15-year-old girl got up and talked last night about some things. Another young lady got up and talked about, her personal experience. And as I had told you earlier, the statistics say that young women under 16, the suicides and attempted suicides is at 40%. And that's just to me just very concerning. We have got to deal with the aftermath of taking kids away from their friends and out of school and keeping them at home, doing remote studies, and what that did to them. I'm a Christian, and you and I've talked about it before, and I think God, made us for relationships and a relationship with Him. And I think that's what's missing in a lot of people's lives right now that they need to do. And I kind of got myself in trouble with some folks last night. They asked me some things I thought that we needed to do. And I said, we need to take these phones away from kids. We're giving kids phones way too early now. The average child gets a phone at 10 years old. If it's an affluent family that are techies, it's 7.5. And I think that's hurting children. I think that we ought to keep kids and phones apart until they're about 16 years old, and let them and their minds and imaginations grow without the overstimulus of these phones.
Well, let's jump in a little bit. We'll go down the mental health care path, and we may end up spending a lot of time there. I've got pages of things I want to spend with you, so we're probably going to have to come back. But tell us a little bit about the town halls. What is the purpose? What's the agenda when you're in these town halls? And what is the, objective outcome, desired outcome?
I met the secretary the first few weeks that I was here as
DHHS, right?
Secretary Kinsley. Let me back up. He was deputy secretary, and his responsibility was mental health. When I came on board, and I met Secretary Cohen and told her I was very interested in mental health, and just a background of why that is I've been in the insurance business, as you said, for 34 years now. Sell healthcare insurance and every other kind of insurance, and served on a bunch of boards, served on a hospital board for 15 years. We had a 25-bed mental health facility. And I just kept seeing all these people that were coming in and out of the mental health arena. They would come in and, we'd help them get them stabilized, and then they'd go out and then they come right back in. And then just other people that I was interacting with, and families and stories that I would hear. So I decided, after, I think I've told you also this story, when I got elected, before I was sworn in, I went to visit with every council of state member and every member of the cabinet. And I asked them, I said, I want to interview you and ask you what your priorities are. And if you've served in office, I want 3 pieces of advice from you. And the the conclusion of all that was three things that I learned. One, pretty much a compilation of all of it was become an expert in a field, in something up here, whether it's healthcare, transportation, education. Become an expert, develop strong personal relationships, and let your word be your bond. And that came right down to, even the governor said that. But I mean, when I took every 22 people that I talked to and boiled it all down into what they said, those were the three things. So I decided mental health and healthcare was going to be the thing that I focused on. Reached out to the secretary as soon as I got sworn in, and then met with the Secretary Kinsley, deputy secretary at the time. It's a passion of his, a passion of mine. I said, I want us to work on this. So over the years, we've been doing a lot of things. And then we decided this last year that we were going to go across the state talking to people about mental health. One of the things that's been a problem in mental health is people don't want to talk about it. There's always been a stigma with it. There's always, it's always been the thing that you kind of talk about in the back room, about Uncle Joe or whatever. And we feel like people need to talk about it. People need to be willing to say, look, I'm suffering from depression, or, I think there's something wrong and I need to talk to somebody. So part of this was to not only get people talking about it, but to also listen to people about where they're at and what they think they need. And people will tell. If I read a book a long time ago about leadership, and it says an effective leader leads with their ears. And so that's what we were trying to do. So when we go out, we say just a very few things to get started, and then we open it up and ask people to come to a microphone, tell us, what's happening, what they see, what they need in their area. We take notes. Like last night, it was all recorded. The last one we had was at Wake Tech last week, and the governor surprised everybody and showed up. He didn't tell anybody he was coming. I think the secretary knew that he might show up, but he just walked in the door and spoke for about 15 minutes. And so, so he's behind this. I know, so I keep Senator Berger, aware of what's going on, and he's behind it. I told him before we ever started, I said, I want to go do this, and I want to make sure, everything's good with you about it. And he said, do it. So everybody's supportive of this. And at the end of it, I want us to put together a long-term plan on how we're going to deal with mental health for the next 10 or 15 years.
What are the top three things, if you will, that you're hearing at these town halls?
People can't get services. They don't know where to go. Last night I heard that over and over again is a woman said, my son had this episode. I did not know what to do. I called 911, and the only thing that could be done was he had to be arrested, involuntarily committed, taken to an emergency room, and he's still sitting in the emergency room today. That's not going to work. We have to have a better plan. Now, we do have the 988 number that people can call if they're having an episode or thinking about suicide or any. That's a national number now, and North Carolina was ranked the second most ready to implement that, but people don't know. And the involuntary today, I don't have the number, but on the last day that I got it, we had like 350 people across the state in emergency rooms, either for behavioral health or involuntary commitments. The most treatment they got is maybe a telehealth, telepsychiatry health. Today I've been tracking a 7-year-old for 119 days. He's been in the hospital. They got him out today. I just sent it to the CEO of the hospital. I said, I know he got out, but where did he go? I want to know what happened to him. There's another little child that I met in a residential psychiatric treatment facility that I thought the conditions in the facility were deplorable, and made the secretary and DHSR aware of it. And so the kids were removed from that facility. Well, he ended up in an emergency room, and we just got him moved into Central Hospital. Sad case, terrible case. I feel like the kid's been through things that we don't even want to talk about. But the lack of people knowing what to do. And so what I want to have it so that people, if their child or if their husband or if their parent has a breakdown or an episode, people know where to go, and that there's facilities for them, and that there's trained people to deal with them. And just putting handcuffs on people and taking them to an emergency room and turning them over is not working. One hospital, Mission was telling me today, they've had to take rooms out of service because they get destroyed by folks. And I think they told me they've had 200 and something people that have been either hurt or attacked by people in the last year. We talked a lot about mental health while I was there today.
So share your thoughts, your opinion, or conversations in Raleigh. What do you think government's role should be in addressing mental health? And then more specifically, does the legislature have a role, and what would that be? What would that look like?
I think we need to be encouragers to anybody in healthcare, all of the hospital systems, all of those folks. We need to, we've already done some things. We've removed CON for everything to do with mental health and opioid treatments. So we've opened the door and say, come on. And then now we also, with the Medicaid expansion, now we've also put $1 billion on the table. So I've been getting calls over the last probably month of folks saying, we've seen what you all are doing. We're interested in coming to North Carolina and providing services. So a lot of what the Secretary and I've been talking about, okay, what are the impediments to people coming and to people providing services? Now, we don't want people coming in that are just going to try to get money and not help anybody. So we've got to really control that. And we're going to try to add some more folks that do inspections and make sure that outcomes are good. Because if we spend money and we don't have good outcomes, all we've done is waste taxpayer money. And as I said, as a business guy, I'm looking for investments, and investments yield dividends. And the dividend is a healthier population. And my goal, I think in one generation, we can make North Carolina the healthiest place to live in the country. If we are smart about how we invest, we've got great hospital systems in this state. It's a fantastic state to live in. I mean, people come here from everywhere and love it. I have clients from almost every state that have come to North Carolina that love it. They either come here because of work, come here because of recreation. I met some people in Asheville that had moved to Asheville just because, they came and visited the mountains, fell in love with it, and came back. So, a lot of retirees out west, a lot of retirees in the east, down at the coast. We're blessed. We're blessed to be here. Great people, great climate, a lot of different activities. And if you come to North Carolina and you're not healthy, I don't think it's North Carolina, the environment's fault. I think it's our fault. We've got to set a better path for people to be healthy.
In that $1 billion allocation in the budget for mental health, are there directions you're trying to nudge people to invest? Are there restrictions or guidance around that? How do you envision that $1 billion being used?
A lot of it's going to be for, we're going to increase the Medicaid reimbursement for mental health. One of the things I've run into in healthcare across the board is the Medicaid rates are so much lower than Medicare rates that a lot of people don't take Medicaid. I was visiting with my dermatologist a couple of months ago, and I was asking her, I said, how many Medicaid, it's a large practice here in Raleigh, North Carolina, and I was asking her, how many Medicaid patients do you have? And she said 2. And I said, why only 2? And she said, well, they were grandfathered in because they went on Medicaid after they were already clients. And she said, Medicaid just doesn't pay enough for us we lose money. And I said, what about Medicare? She said, oh yeah, we'll take all the Medicare. So I got back in the car and I called the secretary and I said, I need to know, what are we doing about paying dermatologists? Because I know people on Medicaid have melanomas and skin cancers and other things. So I'm a prevention guy. So if I can spend money on a dermatologist to check somebody to make sure they don't end up with a melanoma that's gone too far, then to me, that's an investment. So we'll save money. And so raising the rates is one of the big things we're going to do. We don't have enough facilities open to treat people for mental health. ECU's announced they're going to build a large facility. Wake Med's going to build a 150-bed facility in Garner. We're talking to people like Atrium. I haven't talked to Novant, but I want to. I know Devon's looking at a lot of things, and I know they're dealing with all the same things too. UNC's helping us with a 54-bed facility at Butner. It was a facility that we already owned. That I went to visit it when we first started talking about it, and
Butner's one of the state prisons, right?
it's called the Black. Yeah, it was a treatment center. It was an opioid treatment center for adults, but it was a 90-bed facility. So, and I went up and toured it. I didn't really know what to expect. I was saying, well, I'm afraid it's going to be like some of the other state facilities that I don't know that we want to use. But when it's a great facility, beautiful. It's well maintained, and so UNC, we partnered with them, and they're going to turn it into a 54-bed adolescent mental health hospital. And I didn't finish my thought about that. 350 people, 50 of those people, of those people that are involuntarily committed into the emergency rooms in the state are children. We don't need to be holding children in an emergency department, not giving them any kind of treatment, no education. The 7-year-old that I've been tracking, the nurses were providing books and toys and stuff for him. They would take him outside, but the only time they could take him outside, because they have to have a protected area, was when the helicopter was gone, and because it was a fenced-in area that they could take him and let him play. And that, one of my grandchildren is 8 years old, and so when I go visit facilities or anything, I come back and I'm remembering those kids, and I'm looking at my grandkids and say, what do I want for my grandkids? And I want the same for every one of those kids.
That's good. On the Medicaid expansion, are there particular provisions? I know CON was linked to it initially. Medicaid, as people know, is an entitlement program. It's something when you meet the requirements, you're eligible. When you get a job or things that you may roll off Medicaid, but you said we're going to have almost a third of the state with the expansion. And you made the comment, which I was writing and wrote the same word than you said, unsustainable.
It is unsustainable.
So how do we reverse, for lack of a better term, people needing to go on Medicaid? Because sometimes it's their lifeline, right, to healthcare. So what are the alternatives you see?
Well, first of all, we're going to be doing a better job about redetermination, and a lot of it's going to be a lot more. The determination and redetermination is seeing who's qualified to go on and come off. Right now, there's almost 3 million people that are on Medicaid. We added a bunch of people during COVID because we have not been able to remove anybody from Medicaid since COVID started, because they basically said, if you've lost your job and you meet the criteria. So all we were doing now for almost 3 years is adding people. We couldn't take anybody off. That was a federal requirement. So we've gotten it up to almost 3 million people on Medicaid. So if we add another 600,000, that's what the governor's estimated. Now that's 3.6 million. Well, we're sitting about 2.3, 2.4 million in the state. And that's how I get to over a third of our people are now on Medicaid. Now about 500,000 of those are children. I think that's right. Maybe it's 300,000 of the. Okay, it's a little over 300,000 are children. 500,000 total have been on Medicaid for more than 10 years. Now, my thinking and what we're talking to the secretary about, and I've talked to the White House. I've been on 3 different calls with folks at the White House. Secretary's been on calls and been up there. We want to take Medicaid dollars and folks that are on Medicaid, pay for them to go to community college, and pay for childcare if they have children while they're at community college, and then make sure they have a job. The only way that we can do this, and we need them to work, we need them in the workforce. So the idea is I want to have a smooth system of transition to get people off of the entrapment of a government program. Because again, as a Christian, I believe you're happier when you're self-reliant, self-sufficient. And I know for a man, because I am one, that nothing gives a man more pride than being able to take care of his family and himself. And I think we're depriving a lot of people of great joy in their life by them not having a job.
Well, and a job obviously is the ultimate solution to Medicaid. It's just how do we help people? I mean, I know in the state we have working with DIT, Department of Information Technology, and on the oversight committee, there's 26,000 open positions right now in cybersecurity. And I would guarantee you, even the younger people, they have the ability to pick the knowledge up necessary to fill a lot of those types of positions. So it's getting them, like you said, the proper training and education so they can go take on those kinds of positions that are there.
I think every department in the state has openings right now. The Highway Patrol had 220 something openings the last time I checked. Corrections had close to 3,000 openings. Secretary has 17,000 employees, and I think he's got thousands of openings. You know, and I don't mean just nurses and doctors. You know, we need you know, administrative folks, analysts. I tell folks, go and apply for a job. There's tons of jobs out there, and you know, every one of our dealerships, we've got 4 dealerships, and every one of those we've got job openings. I insure a bunch of businesses. All the businesses I insure, almost every one of them has job openings. I own a restaurant. I don't run it, but I own it, and I know he needs 8 people right now. And they make good money. I mean, this is not minimum wage jobs. I don't know anybody right now that's paying minimum wage. The effective minimum wage in North Carolina is $15. You know, you can say what you want to, but it is. Now we still have some workers in some of the aid positions that aren't making enough, and childcare that's not making enough. But we've been subsidizing those. Excuse me, and we're gonna do that again in this budget. You're going to see more childcare. Subsidy for childcare workers, subsidy for home health workers, subsidies for nursing homes, because we did it. We used COVID money to do it, maybe too much. Well, I know we spent too much money during COVID. That's why I think we're seeing the inflation and everything else that's going on. But we have to make a transition. We can't just take that money away. I tell folks, you can't give people a raise for a year and then take it away from them, because you have effectively helped them raise their standard of living. Plus, gas went up, food went up, like, you know, energy went up, everything went up, and you know, the raise they did, they've spent it. Now, if you take it away from them, you're going to put them maybe on Medicaid.
But how do we, you know, on the flip side of that coin, how do we sustain that, and how long can we subsidize income?
I think we're buying ourselves 2 years with this budget, and I think we've got to figure it out in 2 years, because we can't come back and spend another $300 million on child care subsidies and another $300 million on you know, all the different health related, and the people we're subsidizing, a lot of them work for companies. You know, they work for companies that either they're not for profits or some of them are for profits. And you know, we got to figure that out. We cannot keep doing it, especially if we have a downturn in the economy. And a lot of people are still predicting that third quarter, fourth quarter of this year, we're going to see a downturn. Now, I think if it happens, which I think it could, but I think North Carolina will be one of the last to go into an issue, and probably one of the first to come out, simply because of our tax structure, our you know, plus we're in good shape. I mean, we're going to have $5.5 billion in a rainy day fund when this thing's over, plus other money that's scattered through the system. So, you know, I'll brag on our leadership. Our leadership has done a great job in the last number of years of making sure that we're in a position to where we can weather a storm.
Sure. I'm gonna shift a little bit, staying all in healthcare. Is you're in a more rural area.
Yes,
I'm in a big metropolitan area. We have big hospitals, 1,000-bed facilities, satellite facilities that are, you know, multiple hundred beds even. How are we addressing the urban-rural divide and the closure of so many rural hospitals? How do we provide access to that care statewide and ensure that we don't keep closing doors on facilities?
You know, we've got about, I won't name any hospitals, but there were about 7 that we identified that we were really concerned about whether they were going to stay open or not. And one of the things that's really going to help is this HASP money, the money that we're getting from the Medicaid expansion, which is a lot of money. The total money from Medicaid expansion, including the bonus, is about $12 billion. So that is just a lot of money between the 4.3 for Medicaid expansion and the 3.2 of the first round of the HASP and the 1.7 from the HASP and the 1.8. And, there's just these blocks of money that are going to be coming in. So
And I know and I apologize for, I know you've been one of the proponents, particularly on the GOP side, which there hadn't been many, that was an advocate for expanding Medicaid.
I didn't used to be an advocate, and I'll tell you why. I thought we were wasting a lot of money. And what helped me get there was going to the managed care model, where we went away from fee for service, which means somebody provides a service, they send us a bill, and we send them a check. Now what we do is we pay the PHPs, the Blue Cross, United Healthcare, and all those folks, we pay them a set amount each month, and then they provide for the services. Now what we've done is we've leveled the field. It's kind of like if you have electric bills that go up and down, and you go on a set rate with your electric company, so you know what you're going to pay each month. You budget accordingly, and then you start looking at ways to save energy, and that's what we're doing right now. So we've leveled the playing field. Now what we're doing is saying, okay, what can we do? Now I look at this pot of money, and as a business guy and a financial guy, I have a fiduciary responsibility to help the state handle money as reliably as possible. It would not be a good move on my part for the state to turn down $12 billion. So if we could take that $12 billion now and invest it, that's where we're going to get, I think, the help on the mental health. If we can just keep the involuntary commitment people out of the hospital, out of the EDs, that generates over $300 million a year in savings, just keeping them out of the EDs. So, it's that old, are you spending smart money? And we've got to spend money smartly.
Well, and that's the same thing with Medicaid population. They typically, the front door to their healthcare is the ER. It's not their primary care. And it's how do we get them directed to their primary care physicians and providers on a regular basis? Because they struggle because they're working multiple jobs, even at that, having transportation, and seeing their care providers on a regular basis. And that's why I was concerned. Do you see any shift or any discussions around delivery model changes, more telemedicine, different types of levels of providers throughout the state, which has been a restriction?
All of those. We've got to have more places that stay open at night and on weekends for folks. We've got to have more childcare that for people that work on a third shift. We've got to have, you look at across the gambit, people tell you what they need. We just don't do a good job of listening to them. And that's what I said about last night. People came up to the microphone over and over and talked about what they couldn't get. So I think listening tours are a really good thing, as long as you listen and come back and do something. Now, if you just go listen and then come back and say, well, I check that off as a box, but that's not what we're doing. We got some ideas in these past 2 days that we're going to try to incorporate into this budget. I've already started working on some provisions to fix some of the things that we heard about while we were out visiting with people. But we get back to the whole delivery thing. And the rural area. I want somebody that's in Bertie County or Franklin County to have the same. They'll never have the same exact services because we can't duplicate. We can't do open heart surgery in Bertie County, and we know that. We don't do. Look, the most we do in Harnett County as far as heart is we can do cardiac cath. We don't do any open heart surgery there. Now we do orthopedics and we do all that. But back when I was a county commissioner and everything, we got a certificate of need for a linear accelerator. Well, not even Wake Med doesn't have a linear accelerator. So, we're trying to bring things rurally. I don't want somebody to have to drive to UNC or to Raleigh to have their cancer treatments. I want to be able to do some things local. People, I think people, especially sick people, need to stay as close to home as possible. But I don't ever expect us to do everything everywhere. We're going to end up, what we have pretty much now is 5 regional medical behemoths that can do everything and do it well and very competitive. And then what I want is I want care out to handle 85 to 90% of the other things you need out locally that you can be at within 25, 35 minutes.
Can you talk to some of the policy aspects of care delivery that you guys have been dealing with? We've struggled over the years and there's debates on both sides. Like, I know there's 25, 30 counties having OBs. And there's discussion of to date nurse supervision is required physicians, but it's a little concerning to say, okay, I don't have access to an MD, so go see a PA. That's good enough. Well, maybe it isn't diagnosed. Should the doctors be direct? And I'm not saying we solve this. Doctors should be directing. Okay, yes, a PA should see this, an RN or a LPN can do that. But where is the balance versus having no care? Like having the ability to have a doula or a nurse midwife who's certified when is better than nobody, unless you're going to a vet.
You're the smartest guy I've talked to. If you've been looking at notes that I've been, I love your questions are right on. And here's my little speech. There's 3 counties that don't have a primary care doc. There's 20 that don't have a pediatrician. 23 don't have an OBGYN. 31 don't have a psychiatrist. In the 9th most populous state, that's the best state in the country to do business. Now, what doesn't rhyme with all of that?
I need to get a copy of those stats. Those are amazing numbers.
I can give them to you, and I check them out. I was with a psychiatrist last week, and I said, "Is this?" And there's about 800 psychiatrists in our state, but they're concentrated. UNC's got over 100 sitting at Chapel Hill. Duke's got over 100. The folks down at when I was down visiting with folks in Charlotte, down at Atrium, they've got over 100. There's a lot of them in our mental health hospitals, but they're usually concentrated. And there are very few psychiatrists in rural North Carolina because just of the population. And no offense, but a lot of folks don't want to live in rural North Carolina. They want to live in Raleigh or Cary or Charlotte or wherever. And at one time, of all the psychiatrists and I think all the physicians at Cherry Hospital, not one lived in the county. Every one of them lived. The head psychiatrist actually lived in Harnett County and would drive to Cherry every day. So, part of that is something we really have to work with. Now, part of the money in the budget, I think there's a total of $40 million. It might be 60 because we've been changing the numbers, is to pay for folks to go to medical school and they work 5 years in a designated county and we forgive it. And we want to, and then I jokingly say, and we're going to start a matchmaking company to get them married to somebody in that county they go to. Because the statistics show if you do your residency somewhere, you will stay there. If you practice there for a number of years and get involved in the community, but if you marry somebody local, you're probably going to stay there. So
actually, the doctor's wife's mother residence is the key anchor.
Say that again.
Vic Pillsbury, UNC ENT, he did say where residents moved to, and it's within 30 miles of the wife's mother.
Okay. Well, there you go. You've got it from 2 different places right now.
And Dr. Miltich is who is dressing, so he's a retired physician. He's one of the guys you want to put back to work.
Look, I tell Doc, the word retire is not in the Bible. I can prove it, show it to you. It's been certified by the deans of the seminaries, and we need you back at work.
I'm just working in different ways these days.
You don't have to work every day, but we need you. We need your knowledge and experience, and mostly we need your hands. We need your brain and your hands.
Okay, I got a couple last questions. We're kind of getting to the time. We're keeping you on a Friday afternoon away from your grandkids. But here's the tough question today. I know one of the pieces of legislation that was introduced, I have an idea where it came from, but I'd like to understand it and the thoughts, because what you read in the paper, I used to tell my wife, we'd talk in the evening while I was in Raleigh and she was at home here, and I'd talk about what we did the prior day. And she goes, I read what you did in the newspaper. That's not at all. What you just told me is not at all what they said in the paper. So can you walk us through a little bit the provision? I know you're trying to get a commitment of like $150 million in savings, I think, across out of the largest hospitals in the 12 largest counties. And then you're going to tie it to their licensure requirement. So at least and so if they don't save $150 million, we close all our hospitals or something. I don't know. It just seemed kind of pretty out there.
And here again, you've been either listening or reading a lot of things. That was a Ralph Heiss, Senator Heiss, made that comment in the news release. I had breakfast with him this morning in Asheville, and we were talking about some of these things. And the idea is if the hospitals can't help the state health plan, it's a state health plan, what he was talking about, save that money, that it would jeopardize their license. Here's two things that the treasurer has been talking about for years, and a lot of people have been talking about. And you know, we are one of the highest healthcare cost states in the country. I think fourth highest. I think that comment and the idea is for us to have a real in-depth conversation about transparency and cost. You know, what services do you buy that you don't get a cost for? You know, if you were going to buy if you were going to do some work at your house, you're going to get an estimate on it or get some prices. If you're going to go buy a car, you're going to get some prices on it. But when most people go to healthcare, there are no questions about price, because usually somebody else is paying for it, whether it's the state health plan or Medicaid or Medicare or somebody. There needs to be those conversations. And I think that this is a good conversation starter about cost. And you know, here again, I want to control and listen and understand the cost. And then I also want to govern outcomes. I think that all of us need to know what we're buying and know that what we got was the service we were buying. And I'm big on reporting, so that I want to know who the most successful organization in North Carolina is for knees, if I'm going to have a knee replacement, or who has the best outcomes in cost for services. I think people ought to know that. I think that's a consumer issue. I introduced a bill in the last session that we passed that said, if you find a mistake on your bill, if you're a state healthcare covered person, if you find a mistake on your bill that results in the state getting money back, you can collect up to $500 of that money. I want people looking at their bills, because
Great incentive.
most people never look at their they call them a explanation of benefit. If you've been to a doctor or a hospital within a month or 2 or 3, you're going to get a package of things that you're not going to understand. It's going to show a bunch of charges, and it's going to say, we charged you this, you got a discount because you're with the state health plan of this, you may owe this, and all that. And I tell everybody, don't ever pay from the first one, because first one's usually not right. But nobody looks at those, because number one, they're complicated and they don't understand it, and it's gobbledygook to them. And two, they don't know what it's supposed to cost. You know, I mean, I tell this story that I had a lady come to me one time and said, Jim, I've got a bill from the hospital for an MRI, but I never had an MRI. And I said, well, are you sure that you know, maybe you were sedated? She wasn't. She was never sedated or anything. And she had called and they said, well, no, you had an MRI and you need to pay it. And so this went on for a while. And finally I said, well, let's do this. Let's call the hospital. As we called them, we said, we want the results of the MRI. And they said, well, we'll have to get back to you. The next day they called back and said, well, we've struck that out. I mean, you just got to think through some things, but MRIs can vary from $600 to $20-something $100. It depends on what the negotiated rate is with the hospital. And I think that's what's confusing to people. Nobody understands healthcare.
Is there any, I don't want to say interest, but is there any action around trying, you know, because there's friendly billing initiatives that have gone on for decades. We did some price transparency stuff under Senator Rucho. Is there any current effort to create a group to try to figure out how to solve, with the help of the stakeholders, the hospitals and care providers, how to figure out how to get access? Because I've said for years how we cost, price, discount, finance, healthcare is completely broken. Absolutely. We have the greatest clinical care in the world, literally, and I can come back to but how we pay for it and finance it, it's totally broken. Just how do we at least fix it on a local level, saying North Carolina.
I
Any
do,
thoughts?
and yes, and I love to get people together. When I worked on a pharmacy bill, we had 35 people in the room during COVID talking about how to do things in pharmacy to save money. And out of that came long-term injectables, for mental health and opioid treatment, doing more things with smoking cessation, hormonal contraceptives for women, so they didn't have to go to the doctor. They could just walk in, answer some questions, and get a prescription for hormonal contraceptives. There was a whole list of things that we put in a pharmacy bill, but it was because everybody got together. Now, there was people that didn't like certain things, but everybody came to an agreement, and we got to do the same thing. But you got to be careful about you get all the hospital CEOs together, and you're probably breaking some laws. So you got to be careful how you do that. And so I want to. If there's any lawyers listening, I understand we got to approach stuff very cautiously, but I love getting people together to work on big problems.
Well, that would be a good one to solve, obviously, for all of us.
Right.
Well, let me ask you one last. What's that?
I'm recruiting you to help.
All right, I'm in.
Right.
The last question, most important question of the day before we let you go. What do you do for fun?
I love this. I mean, there's some, I know people ask Ann all the time, says, Jim ever going to retire? She said, he'll never retire. I love working. I love getting to talk to people, the relationships. I think God just made me for this I tell people, and I've told Senator Burger this, is that there's something that nobody else wants to do, or give it to me. Let me work on it, because I just love the process. I didn't know that I would enjoy working on bills and things as much as I do, but I turned out too many bills this year. I mean, I probably did 50 something bills, and I need to focus. I have good friends that say, Jim, you need to focus more. And I'd say, I am focused. I'm just focused on a lot of things. And we're only on this earth a short time. And I've shared this quote with you. It's not my quote. You can look it up. I can't even remember the guy's name. But the quote is, if your presence doesn't make an impact, your absence won't make a difference. And when I go to heaven, I don't want anybody to say that I didn't work to try to impact the environment that I was in. So I encourage everybody, find something you're passionate about and that you love doing, and throw your life into it. Number one, you'll help people. And number two, you'll get great joy. And I think that it doesn't say anywhere in the Bible that we're supposed to be happy. It says we're supposed to be joyful. So we need to be creating joy.
Joyful noise.
I think we create joy by helping others.
Well, I tell you, I appreciate you tremendously. You are a natural problem solver. You're obviously one attribute that's so significant and helpful for all of us, as you care about trying to do the right thing. And bottom line, that makes you, as my dad used to say, the highest compliment you can pay to an individual is you're a good person. And that's fundamentally where it all begins and ends. So with that, we thank you for taking your Friday afternoon to spend with us. You are a treasure for the state. So hopefully you keep doing this a while until you're working out of the governor's mansion.
So are you gonna quit doing what you're doing and come work with me full time to campaign and everything? Is that what you're telling me?
I'm in. If you announce, I'm in.
All right. All right. Y'all have a great day. It's been a lot of fun.
Thank you, Senator. So I'm gonna throw it back to Bill.
Thanks,
Senator
Bill.
Tarte, who's on deck for next month?
That's a good question. It's Friday afternoon. I've been up for 24 hours. I'll have to look. We're planned out through November.
Is it Paul Shoemaker next?
Paul's on the list, so he very well could be. And I know we've got one thing I'm trying to work in is Tricia Cotham, I think, is going to join us, which we had talked about having. And of course, we have the healthcare panel that we're going to be doing in July.
July 11th. Yes, North State Country Club.
So we will have Novant and Advocate Atrium, and we'll have the folks up north in Iredell. So looking forward to having the executives from each of those organizations discuss healthcare in more detail.
Sure. And Luke McDonald, we thank Novant Health, Huntersville Medical Center, for being the presenting sponsor and making this series possible. And thank you for everybody for joining us today. Have a great weekend.
Great weekend.